Thank you, Mr. President. I want to start by saying that I do think this bill is a step in the right direction. I also want you all to know there are pieces in it that I do agree with. My mother and father are respectively graduates of Spelman College and Morehouse, and still fully support both HBCUs that they are alumni of. But they also taught me to advocate for what's true and what's for the greater good, and understanding the difference between small gain and greater gain. Understanding the long-lasting impacts are worth a greater investment. It's kind of, I liken it to how I tell my son, do you want to be rich or you want to be wealthy? And HB 1339, again, is a step. It's well-intended, but it's not the greater solution that's needed. Certificate of need regulations, they were set forth to require that anyone who wants to open a medical facility establish that there is a need for treatment in a geographic service area. And yeah, essentially, it gives that only hospital in the area a monopoly. And however the good intentions, and I do think CON is well-intended, these regulations are, time has told us that they just don't work. They didn't prevent rural hospital closures. We've actually had 9 closures in recent years. They don't keep healthcare costs down. And they didn't allow more Georgians access to the healthcare they need. So I fully agree we needed to look back and revise CON. That was, the House version was seeking to make some changes. I have no problem with that version. HB 1339, as it is in the Senate, allows the creation of short stay and acute treatment centers within the service area. Although this will alleviate some strain on medical facilities and providers and increase access to care, and again, that is a step in the right direction and will hopefully improve some of the Georgian healthcare outcomes throughout the state, it still does not solve the problem of who's going to pay for it. HB 1339 offers tax incentives for project investors, but because these hospitals will be private, they can charge whatever they want. There is no accounting for low income and uninsured individuals to pay for care, no way to compensate providers for their services. Georgia's uninsured rate right now is 13.7%. It's the 3rd largest in the country. And by 2026, the number of uninsured rural Georgians is expected to rise to reach 25%. Clearly, Georgia's healthcare system needs a solution for increasing the number of uninsured individuals. A way to fix that without straining Georgia's financial resources is to expand Medicaid. For every patient without health insurance who presents in the emergency room, the hospital can expect to ultimately collect 5 cents on every dollar charged. With Medicaid, they can expect 80 cents on the dollar. That way, we keep our hospitals, especially rural ones, from going bankrupt. For years, Georgians have been paying federal taxes to expand Medicaid fully and close the coverage cap. Still, state leaders have refused billions in federal healthcare dollars to pay for Georgians' healthcare coverage and stabilize struggling rural hospitals in the name of rejecting Bidenomics, but it makes sound sense. The money is there. And it shouldn't, it shouldn't even take us 20 years. Here we are. It shouldn't even take us 20 years to expand access for the uninsured. Today, I urge my colleagues to not only consider passage of this bill, as we know that there is a source of funding for it, and that means voting no until we can expand Medicaid to keep our hospitals fully funded. I like win-win solutions. We could do Medicaid and con revisions. We can have both. I want the solution that helps our low-income communities, stabilizes our healthcare economy, and promotes economic growth long term. I'm all for some of the pieces in the legislation. Alternative birthing centers, love it. Allowing another hospital to fill that gap we have now in Atlanta, love it. As far as I understood it, though, Morehouse was already negotiating on the con, so it was going to happen anyway. It just might have taken a little longer. It wasn't going to be the fast solution. And I want to address our healthcare deserts. Absolutely for it. But I am asking you all today to vote no on this bill. We could partner this bill with Medicaid expansion. I get that we're going to have a Medicaid commission, that's great, but we already know what Medicaid does, what expanding it does. We have two good models, Arkansas and Mississippi, and I can't believe Mississippi did it over the great state of Georgia. Well, what are we studying? We already know. I've seen bills drafted in 48 hours. We got the best minds out there. So I'm asking for a no vote today. Let's make a win-win solution that we can all digest, one that both expands Medicaid fully. And it is a plan that we can ensure that our governor will sign if we expand Medicaid and do some con revisions. So I thank you all for your time. Mr. President, I yield well.